na kwingine kana movisa mavolisi na matoisi ukunekiliwa mandhanzangili itatu na ilasi ya vithokia vengi wa Equity musine wa matukio koni chomundi na sio ya ilovia itesekaniwe kitu nenzangilino niwendekana kwithwa. Okay, my name is Nzau. I'm a journalist working for Eastern Broadcasting Corporation, but normally a household name it's Mbaitu FM. Mbaitu FM is a Kamba radio station that broadcasts in Kamba language. My passion is highlighting stories to do with like bringing solutions to the society. Meeting Journalists for Human Rights, that's JHR, has given me a new thought of who I am as a journalist. It has opened my mind. I can think differently compared to before. Because I remember mostly when we used to go to do feature stories or stories, you just go there, you don't have an idea of what you're going to do. At times, you don't have a list of your news sources or your sources to use in a story or in that feature. So you're just going blindly with JHR coming in place. I remember at first I just thought it's just the normal grants that we get because journalists get grants from different places. But I can say for Journalists for Human Rights, it's totally different from the rest. Because on the onset, you're taught so many things. First, you're given a mentor, a person to mentor you. You work with that person step by step. I remember when I applied for my first story grant, I was assigned a mentor, a person who worked with me. I remember my first mentor was Judy Kaberia, and she was so good because I could come up with a story idea, then she would engage me in that. Yes, you want to do this, then what? So we walked step by step with Judy Kaberia, and I could see a lot of change in the way I came with the story idea and the way we were proceeding on. Through the story grants that I've received with JHR, I remember there's a story I highlighted about a lady who is a cancer survivor, Jen Francis, and after I highlighted the story, it went viral. And I remember I had a chat with the CAS Health Ministry, the Cabinet Assistant Secretary, Health Ministry, that is Dr. Masi Mwangangi, and even she had a chat with Jen Francis on some of the measures that the government plans to help any cancer patient or the survivors. And we can say today the the story grant that I did has led to the government offering help to these ladies who are in a certain organization, and they've been searching for, let's say, things to do with food donations, especially with these COVID times. Most of them, they don't have jobs. Others, their family members were sacked or they lost their jobs because of COVID, and they're receiving help from the government, and there are certain measures that the government plans. Lastly, when I spoke to Dr. Mwangangi, she says they are pushing to see whether these cancer patients, they can get like at least 70% of the treatment from the government, because a lot of cancer treatment is expensive, and at times the patients are needed to go abroad for further medication.